Marijuana's been touted as a remedy for morning sickness, so more women are using it while they're pregnant and even while they're breastfeeding. But the nation's leading group of pediatricians is sounding an alarm, saying we simply don't know enough about the effects of the drug on a child's developing brain. Dr. Malika Marshall is here, and is it really that common during pregnancy?
So it's estimated that about 1 in 20 pregnant women use marijuana, and in areas where it's legal and readily available, as many as 20% of women who are breastfeeding actually use marijuana. Now, there was a small recent study that found that THC, which is the active ingredient in marijuana that causes the characteristic high, has been found in breast milk. So the American Academy of Pediatrics is saying, look, until we have more information about how marijuana affects a developing fetus's brain or baby's brain or young child's brain, that pregnant women and women who are nursing really should avoid it. The American College of Obstetricians and Gynecologists is in agreement.
But you can see why there might be a gray area given its acceptance in other circles.
Exactly.
Other story we're following now, and this is interesting. People who have deep furrowing of their brows, more than, let's say, is typical for their age, may be at higher risk for heart disease. Okay, we're talking about those like squinchy wrinkles right up here, right?
Squinchy wrinkles that some people think are unsightly, but they actually may portend something more serious. These were researchers in France. They looked at more than 3,000 adults and they measured sort of the depth of the wrinkles of their forehead, from no wrinkles to what they called numerous deep wrinkles. And they found the people who were in this latter group, the numerous deep wrinkles, seem to be at up to a 10 times greater risk of dying from heart disease than people with no wrinkles. They're not sure why. Changes in collagen and oxidative stress are in common between both heart disease and wrinkles. This is not going to replace your BMI, your blood pressure, your cholesterol, other things that we can measure to assess your risk of heart disease. But it might be sort of a easy, quick way for doctors to assess whether someone might be at higher risk.
And kind of a double whammy.
Yes, unfortunately.
Doctor,
but there's always Botox.
There you go. Thank you. David, over to you. Lisa.